So basically what I'm going to be doing, because on the MRI, the area of questionable signal intensity is right on the underside of that wound. So I'm basically going to plan my route to go from just proximal onto the underside. That's all I'm going to do. So I'm just going to go down like this. I'm hit the bone. Okay.
Yes.
Put this here.
It's a whole thing with Atlantic Home Care and Mary Louise.
I'm glad you're here today to help me. How you doing?
Now what I'm doing
Is
is
feel
I
tugging.
did it once.
using,
Try not to watch.
using this to kind of.
As much as I want
Do you want me
to.
to lean you back?
No, I'm fine. No,
Okay.
I'm
Want me to get you a
fine.
magazine or something?
So what I'm
Like,
doing, I'm
you
just
can
kind
No, I'm
of
fine, no, I'm fine,
separating,
no, I'm fine.
creating a little path
Want me to dance?
with the
Okay.
scissor or
It's
use
like a
that
train wreck. I want to watch.
and down to the bone. Now the bone, I can tell you right now, it's pretty cystic. Like I could see, remember we talked about MRI? I could feel it's spongy, it's cystic. It doesn't necessarily mean it's infected, but there's definitely a cystic feature to it, which tells me a lot of the bone is very soft. There's definitely cysts in it. Whether or not it's infected, that's what we're going to find out. All right, there.
This is
So
on
we
good.
know we're on a good path. So I just made sure the path was clear. And now, do that. So this. Okay. What I do here is I usually always discard a little knob.
You need just a clear cup, right? Nothing in it? Or you need,
That doesn't matter.
you need a
You
formal.
put formalin in there.
I have one already made, this one here.
So if, depending on where you are, you want to try to get counter pressure. But basically, you leave the sharp the trocar inside, okay?
Okay.
And you're going to go right into the area that you just created.
Okay.
And you're going to feel the bone. And you're
Okay.
going to try to pierce the cortex
Okay.
with the trocar. That's what I'm doing right now. So I felt myself pretty much pierce the cortex. So I withdraw the trocar. Yep.
Okay.
Keep
And
it in
then-
there for
and
now
then
because I might
what's
need it again.
Okay.
So now what I'm doing, I usually just like to spin. Everyone does it a little bit different. I usually just try to spin.
And I remember you showing me this before, and I did that once and forgot what the patient was, but we didn't have success.
Okay.
You okay?
Let me know if you feel.
If you need
No, I'm
to,
not.
And you're
I'm totally
angling
fine.
it.
Totally fine.
I'm angling it so that I'm getting the bone
Right.
right behind the wound.
Right.
It's, sometimes you do it and you need to do it again. I mean, it's
Right.
not, it's not a guarantee every time. Sometimes you need to go in there a couple times.
Are you videoing it?
No, I got nobody's face in it.
Hmm?
I got nobody's face in it.
You should put her face in it. She loves being on video.
Yeah, how far do you keep going? Like, how long do you keep
I
doing
a
it?
lot of times, like right now, I'm trying to do it until I possibly feel to get on the other side of the malleolus. So I'll feel a little give.
Okay.
I usually try to do that. It's sometimes you can't. It's everyone's anatomy is different and where you are. The trick is when you withdraw.
Right.
Sometimes it slips out.
You're supposed to try to keep the core inside,
Yeah,
right?
it's which is not, guaranteed. It's not.
Right.
It's easier said than done. So, you okay, bud?
Mm-hmm.
You're still going forward, or you're coming back?
I'm still going forward a little bit, very slowly.
Now, are you pushing hard?
Yeah.
Yeah.
Mm-hmm. Okay, so now what I'm going to do is I'm going to kind of wobble it a little bit
Okay.
to try to loosen up the edges so that the
Okay.
core kind
We'll
of.
slide out with
right.
the needle. Okay.
So I'm just kind of loosening that up. And I'll slowly withdraw, and then we'll see what we got. Hopefully we
Okay.
got something.
Okay.
Well, and you can, if you want to open up all the way and lay it there, that way I can just kind of.
Yeah, it's just, I'm
Play
afraid
with
it's
it.
gonna go flying.
Move the underneath the.
Oh, I'm sorry.
No, you're-
Sorry.
yeah.
I thought I put it in.
It's okay. We can use
Forgot.
the.
Not bothering you.
You can use that. Use the stylet.
So you're just gonna put the piece in there?
No, it's gonna go in here.
No, but, oh, okay. So we, okay.
And you don't just yank it out, you twist it out?
No, because a lot of times if you just yank it out, the cord just slips.
Just
slips
stays
out.
there.
Yeah.
I'm gonna have to
Yeah, I take a lot of time on taking it out
Okay.
because it's tough. Sometimes it slips out, even if you do it really slow like this. Sometimes
Okay.
it just slips out and you have to go in again.
Okay.
One more?
Well, I'm gonna push it out, see what we got, see if we got anything good. It's hanging.
Mm-hmm.
Do you want to see the tweezers?
Yeah, let's open a fresh forceps.
Okay.
Thank you.
Is that the bone?
That's what I'm trying to figure out. It's okay. It's hard. There's hard. There's bone in there. Okay, good. So it's a little bit tricky. You want to make sure that you always feel it real good, so you can actually feel.
Okay.
You can feel bone in there.
Okay,
It's small,
okay.
but that last little piece there,
Okay.
it's hard, and that's all you need.
Wow.
It's all you need is just enough
Wow.
that they can, because they're going to look under the microscope.
Right,
So
right.
that's it.
Yeah, I can see that it's.
Do you want to feel it? You want to put on the sewing gloves and feel
No,
it?
no, I'm fine.
Okay.
I sort of heard you. It
Yeah, you can
clicked.
click. You
Yeah.
can hear it. Yeah. There we go. So all they need is that tiny little segment.
Okay.
So as long as you have a little chip,
Okay.
that's all I need.
Wow.
And
And do you ever
That's
get
it.
you don't go
Huh?
for a second
Try gloves?
sample?
I just wanna hold it.
not unless there's a second area I'm really concerned
Okay.
about. Yeah.
Okay.
No. That's it. You did okay? You
Mhm.
all right?
Fine.
Okay. Good.
Wow. Very cool.
Yeah, it's a nice